I'm Ashley Anderson here with Dr. Robert Harrell of the Harrell Dental Implant Center. Thanks for joining me.
Thank you. Glad to be here.
Dr. Harrell, who is a good candidate for dental implants?
Most patients that present in our office are good candidates for dental implants. We really see only a few different health factors that may make that patient a poor candidate or may reduce the chance for success with dental implants. Main risk factors we see are patients that are smokers, and that does reduce the success rate for dental implants quite a bit. We also see patients that have diabetes are also not as good of a candidate for dental implants. It can still be done, and if the disease is well managed, those patients still experience quite a good success rate. Patients that may have had cancer, had head and neck radiation in the past, sometimes does prohibit us from being able to place dental implants. But for the general population, we see dental implants work pretty well for most patients.
For the candidates that you mentioned that may not be the best fit, is it still worth a consultation, just to double check?
Absolutely. We offer a free consultation with a 3D cone beam scan, and we'll spend the time that we need with the patient to help them determine really what's the right treatment option for them.
If I'm coming to you for my first appointment to talk about dental implants, can you take me through the process? What can I expect?
For a new patient visiting for a consultation for dental implants, the first thing we start with is a 3D cone beam scan. And with that scan, we put it up on the monitor together. We're able to take a look and evaluate what the bone looks like. So we can look at bone density, bone availability, bone quality. Right there at the consultation, we can use our planning software that allows us to place the dental implants in the software, and it shows exactly where we can place the implants in the mouth. So that patient will have a very good understanding that day of what's possible based on their current condition, and then we can look at different treatment options. So we have a dedicated implant treatment coordinator that will come in and spend the time once I've finished looking at the scan and go over the different treatment options with the patient. So when you leave that consultation that day, you may have 2 or 3 different options that could work for you. You have a very clear understanding of what's involved with the treatment, the number of appointments, and also the cost.
And the next step would be?
And the next step would be when the patient's ready to start treatment, we go ahead and set up the first visit, which is typically a records appointment, depending on the treatment plan. For some patients with maybe a single dental implant, it may be to place the implant. So a number of different ways that the procedures will start, but what we like to establish that first day is for patients to just have the time that they need to talk with me about what the options are, and then have someone go over the treatment plans, the costs, and the time that it's going to take.
Can you explain on treatment day, if I'm receiving one implant or multiple implants, the process? Do I need to have someone there with me? Does someone need to drive me home?
Sure. Typically, patients that are receiving dental implants, we do some type of sedation. So we can do oral conscious sedation for many of our patients, and that works great. It helps those patients to be relaxed. They're still able to respond to us, but one of the great things about the oral conscious sedation is the patient has no memory or no recollection of the actual procedure. So they have a driver that brings them to the office. We get them sedated for the procedure. We get the procedure done. We wake the patient up, and they go home with their driver, usually take a nice nap on the couch afterwards. And most of those patients, we check on them in the evening and find that they're recovering quite well. And by day 1, day 2, most report that they're feeling great with minimal, if any, discomfort.
Back to work, back to life.
Back to work, back to life, that's right.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.